Getting better from a concussion can be really simple, but that doesn't mean that it's easy. We have so much evidence that exercise is effective medicine for concussion, but just like any medicine, the dosing matters between something being very effective or something being potentially toxic. For this case, this is Amadeus. He's a client that we've been working with virtually, and he had a concussion. And after about 3 weeks of trying to do exercise after his concussion, he was running into some roadblocks. He was still being very symptomatic. For many concussion cases, we look at the eyes, the neck, the vestibular system, but just from talking to Amadeus, we could actually figure out that he was suffering from exercise intolerance from a fairly recent concussion. So, after a short conversation, we figured out that he was probably exercising beyond his metabolic capacity and he wasn't staying within the sub symptom threshold exercise that is often used in the literature. So before doing anything more complex, we said, you know what, let's just dial back your exercise intensity. Let's have you stay at a heart rate between 115 and 130 and stay there for 20 minutes at a time. And we'll check in again in a few weeks and see how things are looking. The reason we recommend this is because of something called the neurometabolic cascade of concussion. When you have a concussion, all of the ions inside of your neurons actually start to leak out, and your brain has to work extra hard in order to restore normal ionic balance inside of the brain. So while your brain is trying to repair this imbalance in ions, the cerebral blood flow is actually starting to go down, which means that your brain is trying to expend a lot of energy, but it's not getting enough oxygen in order to meet the demands. We call this a metabolic mismatch, and this is the primary physiological problem that happens in the acute phase of concussion. And before we do anything else with the eyes or the neck or anything like that, we have to address this problem. So we started them on a protocol of some symptom threshold exercise, exercising at about 120 beats per minute, and just staying there the entirety of your exercise session. And then you work your way up gradually over time as long as it's not agitating your symptoms. And sure enough, over the span of a few weeks, he's up to 154 beats per minute and starting to approach the 160s, which is our target goal. We say this because when people think about concussion rehabilitation, you often think about using fancy sensory boards like this or getting fancy neck exercises that look like this. While those might be necessary for chronic post concussion cases, when someone's in the acute phase, sometimes we just need to have a change in programming for their aerobic exercise, and that's going to make all the difference in the world.